Hi there, I'm Crystal Harper from AxessPointe in Kent.
And I'm Dr. Dean Scott, and we are here to talk about the fact that March is Colorectal Cancer Awareness Month.
Yes, and so let's just start with talking about how common is colorectal cancer.
Well, colorectal cancer is the second most leading cause of cancer deaths in the United States. It is the third most common cancer that we see. So it's pretty important, and we need to kind of talk about what we need to do to screen for this cancer.
Absolutely, I agree. I mean, just this year alone, over 56,000 Americans will die from colorectal cancer. So screening is very important. So there are 3 different types of screenings. Do you want to tell them about a few?
Sure. One of the screenings that we recommend from our office is a stool test. So in this test, you get a card from your doctor and you take it home, and when you drop it back off, we screen on a yearly basis for colon cancer. That's one form of testing. A second form of testing that we recommend is a colonoscopy. You're scheduled for a colonoscopy with a surgeon, and if that colonoscopy is normal, you don't have to come back for 10 years. If they happen to find a polyp, you may have to come back sooner in 3 to 5 years, but this is a test that you don't have to do very often.
Okay, so let's talk about some of the early symptoms of this type of cancer. So, those symptoms don't immediately show, and so sometimes even there can be no symptoms. And so some of the most common symptoms would be a change in your bowel habits, going from different consistencies of stool, having some extended abdominal discomfort, having any kind of rectal bleeding, or just feeling fatigued, nauseated, any sudden weight loss, just a few of the symptoms that could present.
So when should you consider, at what age do you think that you should check for colon cancer? A lot of people ask this question, so we would like to answer that for you. So usually the recommendations are at age 50 is when you should start to get screened for colon cancer. But if you have a strong family history, we recommend that you may want to consider that a little sooner, maybe around age 45.
Yes, and so for cancer-related treatment, in the event this were to develop, there are quite a few options available. Pretty standard options like surgical, removal, radiation, chemotherapy.
Yeah, so those are treatment options once colon cancer is found. A lot of patients will ask us about probiotics. A lot of people like to take probiotics. They feel that they're beneficial. And we don't have a problem with people taking probiotics. A lot of people have more regular daily bowel movements when they take this, and it does help balance out the bacteria that's in the intestines, but do they help prevent colon cancer? We have not found any evidence of that at this time.
So basically, to sum everything up, guys, we want you to be on top of your care, get early screenings, be on alert for any symptoms, and just try to eat a healthy, well-balanced diet and have some good, solid exercise and do the preventative screenings.
So if you haven't had your colonoscopy or colon cancer screening yet, please stop by our office at AxessPointe in Kent, and we'll be happy to get that done for you. Take care.
Have a great day.